Thank you for that, Mr. Chairman, and for our panelists for this important discussion. I know in my home parish of Jefferson, Louisiana, we've seen spikes in increase of drug-related deaths over the last few years, and each year just seems to be going up higher. When I talked to my coroner in Jefferson, Jerry Satanovich, who works very closely and trying to, of course, they see the end result of it, but they also try to work on the front end and doing some of the education that Dr. Clark has talked about. And others, they've seen that heroin is the one that seems to be popping up the most. I think last year, heroin deaths accounted for a majority of all the drug-related deaths, over 100 of those in my home parish of Jefferson. And like I said, we're seeing this across the board. One of the things they do work on is trying to educate people in the community, and I know, Dr. Clark, you've talked about this in your testimony and alluding to work with not just pharmacists but others. What is the different things that you've been doing, and if you've had success on the education front, especially not just within the medical community, but within the targeted populations of those folks that might have the highest likelihood of being exposed to heroin?
Again, one of the things, a comprehensive strategy becomes critical, and that starts off with prevention, working with community coalitions so that we've got that message. We've already heard about the issue of chronic pain management and people moving from the use of a prescription opioid to drugs like heroin. So having good strategies for pain treatment, working with state health and territorial health officers, Federation of State Medical Boards, nursing organizations, dental organizations, and even veterinarians, because they too have access to prescription opioids, that we can address that end of the agenda. And then our colleagues,
Mr. Renazizi to
our colleagues at DEA
answer this too, because I know you talked about this in your testimony as well. So if you can touch on your experiences there.
We never turn down the opportunity to go out and speak to professional organizations. We have a very good relationship, or fine relationship, with the National Association of Boards of Pharmacy, the individual pharmacist associations, and the medical associations. When they ask us, we will come out. The Pharmacist Diversion Awareness Conference, we go out and we've been to 14 states and trained over 6,000 pharmacists in their corresponding responsibility, their trends in trafficking for pharmaceuticals, to make them aware of what's going on so they know how to deal with this when a bad prescription comes in and what they're supposed to do. We have industry conferences. We bring industry in. October of last year, we brought the distributors in to talk about what we're seeing trend-wise and what they need to do as far as their legal obligations under the Act. We bring the manufacturers and importers in April or May of last year. We brought them in, and we do this on a regular basis to show the trends in trafficking. We are out there educating as much as possible because it is one of the pillars in the pharmaceutical initiative that the White House is pushing forward.
One of the things when you talk to the people on the ground, our local, whether it's coroners, law enforcement, there are a lot of different federal programs out there, and I do want to touch on that GAO report because there are some concerning issues that they raise that have been touched on a little bit, but I want to get into a little bit more. But on that front, when you look at all the grants that are out there, I know in Louisiana, I think grants come in from 5 different departments through 30 different programs for some of these treatment programs. So there's a lot of overlap and duplication. But is there a better way maybe to block grant these, to put them together in a way that would be more flexible? And maybe, Dr. Clark, you can answer, are we giving states enough flexibility today? And with the duplication, can we do a better job of maybe consolidating those grants in a way that allow the states to do what they do best without having to go through so many different processes, through so many different agencies where you have this duplication?
Well, clearly, we have to work with states in their exercise of their discretion and how to prioritize what it is that they view as important epidemiologically in their jurisdiction. And so we have supported the use of block grant funds to the discretion of the states and work with both the individual state authorities and the national organizations associated with that. We're also working with recovery-oriented organizations so so that we've got peers, people who are recovering from substance use disorders, to help speak up and carry out the message, working with community coalitions and others, because indeed they can tell a better story than professionals or regulators, et cetera. So
Okay,
the comprehensive strategy.
And let me, I apologize, my time's about to go. I do want to at least ask for the record if I can get this information on the GAO report, because it did identify, you've got, 15 different federal agencies, 76 different federal programs that all have abuse prevention treatment programs, and they also identified overlap of 59 of the 76 programs. And so I think Dr. Gingrich earlier asked Mr. Botticelli and Dr. Clark to talk about what your agencies are doing to address that overlap, those problems that were identified in the GAO report. If Mr. Sosin, Dr. Sosin, I'm sorry, Dr. Volkow, and Mr. Renazzisi can also get me their information to just show what y'all are doing to try to address the overlap problems that were raised in that GAO report.